Gosh, I'm Dr. Michael Craig. We met earlier, I did the examination, posture exam. I sent you off, you got some x-rays, now you're back. And we're gonna go over the x-rays together, and then I'm gonna adjust your spine and hopefully give you some relief, and then I can tell you a little bit more about what to expect, okay? So, we knew that it was mostly, the exam pinpointed that mostly it's in your neck, is that correct?
Yes, sir.
Neck and mid-back?
Neck, upper back and lower back.
Neck, upper back, and lower back, okay. So, I'm gonna put the x-rays up. I haven't seen these before, so we're gonna look at them together, okay?
Yes, sir.
So this is an A to P open mouth shot, which I'll get to in a minute. This is your cervical spine. They didn't get the bottom part of the cervical spine, but this is enough to go by. And we also have your low back, the side view, and the front view with the full pelvis, okay? So let's go with the upper back first, the neck first, because that's one of the most crucial aspects of your spine, to make sure that's in alignment so that you don't have pain in your neck and your head. Are you having any headaches? No headaches, just neck pain, shoulder pain, arm pain, stuff like that. What I'm going to do is I'm going to pinpoint some areas here to be aware of, just so you'll know that when I treat you, you'll know exactly what I'm doing, okay? So the first thing to do is to look at what a normal spine looks like. And if we look at the neck, this is a textbook normal neck, okay? I don't know if you can see that, but there's a curve in the neck. All the bones themselves, all the vertebrae are very clean. In other words, there's no arthritis, there's no osteophytes or things sticking out from the bones, things like that. That would indicate arthritis, okay? The spaces between the bones are called the disc spaces. Those spaces are fairly even in a textbook normal spine. And you can draw a line basically in the back and also in the front, and that line is connected. In other words, everything is connected to everything else. So that's what we're looking for. First thing that happens, there are three phases after that: phase 1, phase 2, phase 3. These are increasing problems for the spine. If you don't get adjusted, if you don't get care, usually spinal misalignments with nerve interference don't get better by themselves. Okay, that's the problem here. So what happens is phase 1 is that you lose that curve in your neck. It puts a lot of pressure on the facets in the back here, and also the nerve roots that come out the back. The nerve roots are those little areas of the spine. The spinal cord goes down that way. Nerve roots come out from back, and they go to the shoulders and the arms and so forth. If it's straight, you're putting pressure back there. You're probably going to have shoulder pain, arm pain, etc., etc. Okay? And then it only gets progressively worse as you start getting arthritis in the spine. Things start happening where you have little growths of the bone. The bone starts joining the joints. It starts growing bone just to try to slow down that misalignment and sort of help the body to stabilize. The only problem with that is it usually hurts. You usually have problems in the spine. Okay, so let's look at your spine. What I'm showing is that you've got a little bit of, actually quite a bit of a phase 1 where your neck is fairly straight. Notice you don't have a curve back here. There's no curve. Let's see, 1, 2, 3, 4, 5, 6. We're not seeing the 7th cervical vertebra, but we're seeing 6 of them, which gives us a good idea. I can see the 6th disc space. The disc spaces look fairly even, so that's the good news. Also good news is that the vertebrae themselves look fairly solid. There's no arthritis that I can detect in the spine. So you're fairly young, so I wouldn't expect that anyway. But there is a loss of a curve. So what I would expect is that you would have shoulder pain, arm pain, which you do, correct? Okay. Also the atlas, this is the top bone in your neck. The atlas is named that way because in mythology, Greek mythology, Atlas held up the world. The atlas bone here holds up the head or the skull. Okay? And your whole spinal cord goes from the brain up in here, down through the back of the atlas, down through the backs of all the vertebrae, and then they end in the tailbone there. And they start getting, it starts getting less dense as it goes down. In other words, there are more spinal nerve roots that branch off the further down the spine you go. So the most amount of nerve roots are available right up here in the upper cervical region. So that's a very important area that we're looking at. The atlas is a little bit leveled off. I would expect the atlas to be a little bit more tilted upward like that. That's not a major problem, but when you lose the curve, that's what happens. The atlas starts dropping a little. What that does is it puts more pressure on the spinal cord. Here, what we're looking at here, this is the right side, so we're looking at your head. You had your mouth open, remember that? Your mouth is open. The reason they do that is to see the atlas, the body of the atlas on the left and the body of the atlas on the right. And then this little thing that sticks up looks like a thumb, which they call the odontoid process, which is part of the second vertebra in your neck. Okay, the odontoid process is important for a major reason, and that is it will tell me, it acts as a benchmark. It tells me whether or not your atlas has gone left or right. Now, if we look at the atlas body, we can see there's a gap. There's a gap right here, as you can see, and there's a gap right here. Which of these gaps looks wider to you?
The left
The one on the left. And you're absolutely correct. The one on the left is wider, so that indicates that the atlas has slipped to the left. You've got a left atlas. We're going to be adjusting that. The way I do that is I set up on the atlas and I essentially push it to the right. And it should click into place and everything should work as expected. Sometimes it happens like that. Sometimes it gets a little stubborn. Sometimes you've got a lot of muscle stiffness in the neck. It just depends on how your neck is. That's the approach I use. There are different ways of getting this, okay? Also, what I would be doing is focusing on putting the curve back in the neck, which means I would be adjusting C4, C5 area, sort of helping the curve come back into the neck, bringing that back there. Sometimes there's a little rotation. If so, I'll take the rotation out. Sometimes it's a straight shot where I just adjust, for example, C5 in a drop piece, and you can get relief that way. But either way, it's going to take pressure off the neck, off the cervical spine, and give you, hopefully get rid of this pain in your shoulder and your arm, okay? Atlas here can also affect something other than having the whole spinal cord going through. There's another nerve called the vagus nerve, which comes through the atlas, and it affects just about every organ in your body, your heart, your lungs, your liver, your stomach, and so forth. That's why sometimes when you get in an auto accident or you get your head jerked around, sometimes you might feel nauseous. That's because it's affecting the vagus nerve, and so that happens quite a bit. Any questions about the neck? Low back, same thing. You've got very clear, defined vertebra. There's no arthritis in the spine that I can tell. The disc spaces in between look fairly even, and in fact, you've got evenness even in L5 S1. That's the fifth lumbar vertebra and the sacrum. It looks a little bit pinched in the back here, so you might have some pinching going on in what is called the sciatic nerve, which a lot of times it goes down the leg, usually in the back of the leg, but most often it starts and goes into the buttocks here. Now you're having pain, what, in the hip area? The buttocks? Is it in the buttocks area? Right back there? Okay, so this is not too compromised, though. You still got enough disc in there to where it's not really pinched. When it gets really pinched is when you start having problems down the back of your leg, all the way down into your knees and then your feet, okay? That's not happening with you yet. So what I would be doing is adjusting mostly the sacrum, also the lumbar area, taking pressure off of that nerve and giving you less pain, taking away some of the pain, giving you more relief, okay? On this is the front to back picture. We're looking from the back here. This is the right side of your hips. And when I look at the hips, I look to see if they're balanced. First of all, yours appears to be balanced. The openings here at the base of the pelvis appear to be equal. There appears to be the same width here as here, maybe a little bit wider here than here. That means that sometimes the hips will rotate in or out. I'm looking for rotation, I'm looking for balance in the hips, and I'm looking for scoliosis in the spine. You don't seem to have much of any of that. Okay, yours is fairly straight. I don't see a problem with that. Sometimes when the hips are rotated, I can tell that, and I have a lot of work to do with the hips usually. And that can also affect the low back cause problems. Your biggest problem is you've got a flaring out of the sacrum, which means I would mostly adjust the sacrum, push this in, take pressure off that L5S1 joint, that sciatic nerve, give you some relief that way. Okay? Any questions with that?
No.
Okay? Now what I want to do now is I want to put you on the table. I want to adjust your spine, and then afterwards we can go over, I'll have a better idea how your body adjusts to that no pun intended, and then I can give my advice based on that, okay? So let's have you lie face down.
Face down.
Yes, put your nose right in here. Put your nose right there. And let's have you move in just a little bit. Okay, excellent. All right. And what I'm doing is checking the leg length here. And that tells me about how your hips are balanced, and it also tells me the state of your spine. Sometimes it'll tell me even about your neck and other things. Okay, so you've got a short right leg, which, as I noted before, this tibia bone, we tested that, this tibia bone is shorter than this one here, so I would expect this leg to be shorter. But sometimes the body adapts to that. But it does get longer when I do this, which indicates that your hips are rotated slightly, okay? So I'm gonna go ahead and adjust your hips. Okay. This hip is rotated back just a little bit on the right, so I'm gonna do a drop move right now, which will just sort of bring that back. And I'll also rotate the other hip the other way. Do this 4 or 5 times. And one more time. There we go. And then I check the legs again. And it hasn't really moved much. So there's something else going on in your spine. And I think it's probably in your low back. So what I'm going to do is adjust your sacrum, which according to the x-ray, that's where the attention needs to be made anyway. Okay. So I'm just sort of opening this joint a little bit. Like a hinge. The sacrum in L5, I'm sort of opening that hinge a little bit, take pressure off the nervous system, or off the sciatic nerve. One more time. Okay. And that almost balanced you out, not quite. Okay, Akash, turn on your side facing way. And what I'm going to be doing is stretching the spine a little bit, hopefully adjusting that joint right in there.
Okay.
Okay, good. Let's turn you over on the other side now. And face this way. Put your arm this way. And just relax one. Okay, good. On your back. That way, come down just a little bit. Okay, so you twisted your spine a little bit this way and that way. It should give you some relief, but I'll know when you stand up and move around, okay? Now what I want you to do is take a deep breath, and you can blow it out slowly, okay? Blow it out slowly. I'm going to be working on the mid-back area, okay? Deep breath, and blow it out. Okay. All right, deep breath again, and blow it out. And one more time, deep breath, and blow it out. Okay. Put your arms down there, and the x-rays show that you've got a left atlas. I'm going to be getting the here and adjusting the atlas. We're going to be taking a rotation and working on C5 on the other side. Okay. Okay, now turn over on your stomach, please. All right, good. And we'll just loosen up the muscles some. Okay, Kurt, sit up for me. Actually, stand up and walk around a little bit if you will. How's it feeling? Any different?
Yeah, better.
Better. Okay, very good. Stand face that way. Balance has changed. That's good. Okay, have a seat. Have a seat for me. And how's your neck doing? Upper back?
The stiffness has reduced a bit.
Okay.
I still can feel the pain.
You can still feel the pain. Okay, where's the pain?
Yeah, the same idea.
Right in here?
Right here.
Here?
Yeah.
Okay. Adjust that area. Let me try one more time. Lie face down here. Put your nose right here. Most of the time this is in the muscle itself.
Okay.
After I adjust it, sometimes the pain doesn't go away because the muscle has built up what is called lactic acid.
Okay.
Because you've been hunching over for so long, that there's a lactic acid buildup in there. Sometimes pain will remain, okay?
Okay.
But I'll just see if I can get that. Okay. And we'll take a deep breath for me. And blow it out. Okay. All right, sit up for me now. Is it still paining?
It's relaxed.
It's a little better?
Yeah.
Okay. Okay, well, that's it. Any questions about the adjustment itself or anything?
No, sir.
Okay. You've been adjusted before, just for the record, so you know what to expect, so. But a lot of people coming in, they don't understand what chiropractic is about, and I appreciate you taking part in this video to explain that with me, okay? So realistically, what I'm doing is I'm looking at your spine, and I'm thinking probably it's gonna take about 10 visits or so. I would try it maybe twice a week for 2 weeks, and then we can do once a week after that, to give your spine a chance to get better, because this atlas is a little bit too far to the left for my comfort, and so I would want to work with that specifically. Low back looks okay. We're just going to be mostly mobilizing the spine, getting you back to where you feel comfortable with that. Most of your problems in the neck, and so as you knew, the neck and the upper mid back is where most of your problems are. So this is where we focus most of it, okay? And that was a good adjustment. We got that. So you're feeling better.
Yes, sir.
And hopefully you'll feel even better this afternoon and then tomorrow. So let's set you up an appointment starting next week.
Okay.
And we'll do twice a week for a while, and then we'll see how it goes, okay?
Okay.
Is that fine?
Yeah.
Okay.